Understanding and harnessing stakeholder power and the perception of power in the political arena is key to success when implementing policy. Esther Alaveran, Nicole G., Vicky Racconi, and Lauren Rodriguez will present a case study highlighting Margaret Sanger's savvy utilization of print and power to influence business, labor, academia, professionals, and religious organizations in order to promote reproductive rights in the United States.
Margaret Sanger was an American activist, nurse, and educator. While working as a visiting nurse in the underprivileged neighborhoods of New York City's Lower East Side, Sanger witnessed a young patient die from complications of a then-common illegal abortion. From that experience, Sanger devoted herself to advocate for women's rights, which led to the use and legalization of birth control and contraceptives. In 1915, Sanger was charged with illegally dispensing diaphragms through the mail. Then in 1916, she went to jail for distributing contraceptive devices to immigrant women from a makeshift clinic in Brooklyn. Her action brought sexual and reproductive freedom out in the public. Sanger's arrest led to a medical exception to New York's Comstock law, which allowed doctors the right to prescribe contraception for health purposes. In 1921, she founded the American Birth Control League as a part of an education and publicity campaign to gain support for birth control. During this time, Sanger was faced with controversy but continued to advocate for birth control in the United States and abroad. Then in 1952, Sanger founded the International Planned Parenthood Federation. With regard to ethical dilemmas, Sanger coined the terms birth control and family planning. She contended that birth control would lower birth rates, balance the supply and demand of labor, and lessen poverty. Additionally, Sanger advocated for public health and social welfare claims for birth control. She also approached Congress hoping they would overturn the Comstock law and legalize contraceptive practice. Furthermore, she endorsed eugenics, intelligence testing, and supported women in receiving a bonus if they agreed on sterilization.
Though reproductive rights have historically been a topic of great controversy, today's healthcare provider still has significant responsibility with protecting patient autonomy. Regardless of personal beliefs, nurses must work within their established scope of practice, utilizing the Nursing Code of Ethics as a foundation. The Nursing Practice Act is a mandatory body of state law that dictates each state board of nursing to set the scope of practice and responsibility for RNs. These rules and regulations have the full force and effect of the law, and each is to include rules on authority and power, education standards, titles and licenses, disciplinary actions, as well as ethical behavior. The American Nurses Association more clearly defines a code of ethics for nurses to practice by. Additionally, individual facilities may have their own standards beyond previously mentioned organizations. Rights and freedoms of patients do have some protection at the federal and state levels. Though the government does not necessarily endorse or fund abortions, the ACA has made provisions for a longitudinal study addressing the effects of pregnancy, childbearing, and abortion, set to complete in 2019. Title X family planning clinics receive funding to provide contraceptive services, counseling, and reproductive health-related preventive services, with a priority given to low-income people. These services are through community-based clinics that include state and local health departments, tribal organizations, hospitals, university health clinics, independent clinics, community health centers, faith-based organizations, and other public and private nonprofit agencies. California legislature provides for the California Department of Health Services and the Offices of Family Planning to oversee Family Pact, which operates for the purpose of family planning, that is, to provide women and men a means by which they can decide for themselves the number, timing, and spacing of their children through education, assistance, and services.
The birth control movement had an enormous impact on healthcare policy that in turn not only affected the quality of women's health, but also the cost and access for women to health care. The birth control movement began as activists, including Margaret Sanger, responded to two main issues that affected women's health. These issues were an uncontrolled birth rate and the ramifications from illegal abortions. Without access to any form of birth control methods, women, especially poor women, had unintended pregnancies and gave birth to unwanted babies. These were circumstances that affected the woman's economic resources and her vulnerability. Women who elected to terminate their pregnancies either subjected themselves to damaging self-imposed procedures or sought out illegal abortion services. These illegal procedures were often performed by untrained practitioners, commonly under unsanitary conditions, and often resulted in sepsis, injury, and sometimes death. During these times, every large hospital in the United States had septic wards for the care of women with infections as a result of illegal abortions. An example is that of Bellevue Hospital in New York City, which treated more than 7,000 women as a result of incomplete abortions from 1940 through 1954. In addition, 1/3 of those women also experienced infection. Birth control movement also affected the financial status of women, the cost of women's health care, and the economy in the United States. Margaret Sanger predicted that birth control would lower birth rates, alter the supply and demand of labor, and alleviate poverty. In fact, early in the birth control movement, there was a 50% drop in the fertility rate. Today, the use of birth control saves approximately $19 billion in direct medical costs per year. The ability to plan for and space childbirth has improved the health of mothers, the health of their infants, and the well-being of their families, and has allowed many more women the freedom to pursue education and join the workforce. New evidence suggests that the family planning programs in the 1960s and 1970s can be directly linked to a decrease in the number of Americans living in poverty today. Margaret Sanger was a visionary when she predicted that birth control would lower birth rates, alter the supply and demand of labor, and alleviate poverty. Currently, approximately 77% of women in their reproductive years use contraceptive. As a result of birth control, the death rate of infants has dramatically decreased. The rate of women in the workforce has doubled since 1965, and the rate of women completing 4 or more years of college quadrupled from 1960 through 1998. Historically, however, Margaret Sanger was blamed by some economists who argued that the birth control movement caused the Depression by slowing population growth and decreasing consumer demand. The birth control movement also had a positive impact on access to women's health care. Margaret Sanger established freestanding clinics that improved access to women for family planning services. She demanded access to services for poor women that had primarily only been available to the middle class and privileged women previously, and through her advocacy, physicians gained the right to prescribe birth control. Due to the efforts of Margaret Sanger and other activists, birth control extended internationally and is now protected under the U.S. Constitution.
Regulatory recommendations include a new policy that mandates a reasonable amount of government funding for family reproductive health, including abortion services when necessary. Reasonable funding amounts will be determined and distributed by state-assessed needs and projected dollar amount needs based on requested services within each state. The policy will be initially enforced by the federal government and further regulated by state governments. Regulations will be implemented based on area needs, and areas will be defined by municipalities consisting of counties within all individual states. Recommendations for this new policy are stemmed from research-based information found pertaining to the United States. The most persuasive findings found in regards to safety are published by Planned Parenthood. The information issued regarding abortion states most abortions occur before 21 weeks, but there are times where it is needed later in pregnancy due to rare, severe fetal anomalies and serious risks to women's health. Another finding that is supportive to the recommended new policy includes a court case titled Burwell v. Hobby Lobby. The court case resulted allowing owners of for-profit private corporations the ability to deny coverage of birth control to their staff based on their personal religious beliefs. This result is detrimental to many employees that may need birth control for personal health reasons instead of family planning prevention. By allocating the necessary funding to family planning and abortion services, access will not be limited to those in need.
In her time, Margaret Sanger's politics were controversial. Her organization remains controversial today, polarizing Congress and causing periodic efforts to defund Planned Parenthood. Birth control has the potential not only to affect every aspect of a woman's life, but society as a whole. Religious beliefs and ideology also impact issues in politics related to birth control, and it is for these reasons that any issue related to birth control has historically been controversial, remains controversial today, and will continue to be in the future. Most recently, we saw this in action with the passage of the Affordable Care Act. To ensure passage, the Affordable Care Act currently restricts funding for abortions. Other areas of controversy today include the morning after pill, abortion itself, cloning, fetal tissue harvesting, and multiple concerns related to fertility and assisted reproductive technologies, such as with genetic engineering, limiting the number of embryos transferred for multiple gestations, anonymity of egg and embryo donors, numerous issues related to surplus embryos and their storage, whether they can be discarded, used for research, or donated to others, are currently being decided in the courts, along with custody and parental rights of embryos, and the rights of surrogates and gestational characters. These present new ethical, legal, and social issues that will need to be addressed. In conclusion, Margaret Sanger created effective coalitions and harnessed the power of the pen, such as with changing the term birth control to Planned Parenthood. With reflection on her successes, we recognize the brilliance in mobilizing support through actual and perceived power. Thank you.